As with all aspects of physical assessment, auscultation of the heart should proceed in a logical manner over 4 general areas on the anterior aspect of the chest, usually with the patient in a supine position. These were covered in an earlier program. In healthy adults, there are 2 normal heart sounds, often described as lub and dup, that occur in sequence with each heartbeat. The first sound, S1, occurs as the atrioventricular valves close, and the second sound, S2, is produced mainly by the closing of the semilunar valves. Each sound is made up of 2 valve sounds, with one valve sound coming just slightly ahead of the other. S1 is made up of the combined sounds of the closing of the mitral valve, or M1, and the closing of the tricuspid valve, or T1, which comes just an instant later. Basically, this delay is because the left side of the heart beats much stronger than the right, but is not usually heard in a normal S1. S1 marks the beginning of systole, or contraction. And S2 is made up of A2, the closing of the aortic valve on the left side of the heart, just ahead of P2, the closing of the pulmonic valve on the right side of the heart. S2 occurs at the beginning of diastole. Changes in the normal sounds can indicate many abnormal conditions. This includes changes to the first heart sound, S1. This sound is produced by the closing of the mitral and tricuspid valves. These valves close because the ventricles are contracting. Probably the most important factor affecting the intensity of S1 is the rate of ventricular contraction. A faster rate of contraction produces higher frequency at the valves, which would result in louder sounds. Some conditions may cause an increased intensity in sound. These conditions include fever and exercise. There is also an increase with the administration of epinephrine, or with thyrotoxicosis, increased levels of thyroid hormone in the blood. All these are associated with an abrupt rise in ventricular pressure, causing a more intense S1 sound. On the other hand, decreased intensity of S1 may be noted in a number of conditions. This will occur with a thick chest wall, hyperinflation of the lungs, or the presence of pericardial fluid. The intensity may decrease with a longer diastole, the period when the heart chambers fill with blood. Intensity may also occur when there is a lengthened PR interval, since the valves are already partially closed at ventricular contraction. With conduction delays of 0.2 seconds, S2 may even be louder than S1. Because S1 is made up of the mitral closure M1, which slightly precedes the tricuspid closure T1, the S1 sound may sometimes be discernible as 2 separate sounds. This is called a normal or physiological split, heard best over the tricuspid area.